And tonight we're hearing directly from those that serve on the front lines. The largest union of registered nurses in the country allowed its members to speak openly and candidly and straight from the heart. And as 10 Tampa Bay's Bo Zimmer explains, they hope the public, you, me, and government leaders do one thing: listen.
Nurses from across the country are sounding the alarm.
We need everyone to wear a mask. It has to happen.
Members of National Nurses United, representing 170,000 members nationwide, called on the public today to treat COVID-19 seriously and to take precautions to prevent infection before hospitals become overwhelmed.
We are being forced to choose who we are going to pay attention to first. And where do you want to be on that list?
Nurses in some areas are reporting fear and burnout, concern for their patients, but also themselves.
I reached a point where I was numb. I literally felt nothing. And that is a scary place for a nurse to be.
One of the biggest complaints, the continued shortage of face masks and other personal protective equipment.
I have nurses in Minnesota that still wear their masks 8 to 10 shifts. These masks are meant for a single use. There is something seriously wrong when nurses have to take to the streets to beg for protection in the middle of a pandemic.
Marissa Lee is a labor and delivery nurse who shared stories of similar conditions at her hospital in the Orlando area.
Florida is a hot mess.
And she says her hospital is not alone.
The same thing that's happening in Kissimmee is happening in Tampa, it's happening in Chicago, it's happening in Texas. Let us take care of the patient. That's all we ask for.
Hospitalizations just this month alone in the last 3 weeks are up by about 1,000 for check-ins, by the way. So they're seeing stuff that only you and I can imagine right now. Now, we reached out to Tampa General, Bayfront Health, St. Petersburg, and HCA, the company that runs a number of local hospitals across the Bay Area, for their take on the feedback from the nursing union. So far, we've only heard back from one, and that's Bayfront Health. And they told us that they will, quote, continue to adjust staffing to meet the needs of all patients. We receive PPE daily and continue to work every avenue to attain more while managing what we currently have on hand in a responsible manner. By the way, if we get something from any of the other local hospitals, we'll make sure to put it up on 10tampabay.com.